People with underlying conditions, chronic pain or disability should speak with their surgeon or a doctor before starting exercise. A person should stop exercising immediately and speak to the surgeon or doctor if exercise worsens any medical symptoms, exercise is painful, they feel physically unable to exercise. I have the magic edit button, so I was able to edit out every time I jumped up to run when baby was crying. If you can, put baby down. If at any point you need to jump up, check on baby, make sure they're okay, you're more than welcome to do so. This video is not going anywhere. It is here. You can return to it at any time. So I recorded this video when I was 2 weeks postpartum. Obviously I hadn't been cleared for exercise. However, I had severe swelling in my legs and my feet. So I wanted to do some basic movement, get the blood flowing again, and help the fluid work its way out of my body. The first exercise we're going to do is just an overhead reach. You're going to find a comfortable place to sit. For me at this point, it was on a couch, a sofa. We're going to bring our hands up above our head, reach up as possible, and then bring our arms down again. Breathing in nice and deeply and out as far as possible. We're not going to focus on structuring our breathing too heavily. At this point, we're just going to enjoy the movement. Taking a moment out of our day just for ourselves. Going to bring your arms up. And down. And up. And down. Just focus on your breathing. Focus on relaxing your shoulders. Letting the stress work its way out of your body. Moment in time just for you. A little self-care. 2 weeks postpartum, you're in the neck of it. Next we're going to do a side bend. We're simply going to reach both arms overhead. And then bend to the side. You're going to go as far as feels comfortable. Remember that your abdominal muscles, your back, everything are still recovering. Take it slow and gentle. There's no rush. Remember your breathing in. Bring it up. And to the other side. Stretch nice and comfortably. Feel that grip work its way out of your back. Return to center. And then back down to the left. Easy does it. You're going to hold it as long as feels comfortable. If it starts hurting, no matter where it's hurting, your arms, your abdomen, your back, you're going to stop immediately. And to return to center and bring your arms down nice and slowly. Shake out those arms, shake out that neck. Next, we're going to do ankle alphabet. You're going to stretch out your leg and you're going to draw the alphabet with your foot. A, B, C, D, and so on. It sounds incredibly simple, sounds incredibly easy. It is not, especially when your tummy is sore. You have a very bruised and battered pelvic floor. Your legs are all swollen and puffy. You're sore, you're tired, and you're running on no sleep. So if at any point you need to stop and take a couple of seconds before carrying on with the rest of the alphabet, you are more than welcome to do that. I should have done that. I pushed through with the full alphabet. Take it slow, take it easy. And when you're ready, you're going to do the exact same with your other leg. If you're feeling super energetic and that wasn't too difficult for you, you can repeat the exercise. First your right leg, then your left leg. This time you're going to do the letters in lowercase. Next, we're going to do torso twist. Please be very careful when doing this to not overdo it. You're simply going to keep your legs facing forward and twist your upper body to the side. You're going to hold it there as long as this feels comfortable, and then swap over to the other side. Remember your breathing. Slowly in, slowly out. Easy does it, soft and gentle. Hold it there as long as it's comfortable. Feel the tension melt away from your back muscles. And last time, twisting to the left. Next exercise we're going to do is arm circles. You're going to put your fingertips on your shoulders and you're just going to move your elbows around in circles. The circles can be as big or as small as you want. Easy does it, slow and gentle. Remember to breathe in, slow and gentle, and out, slow and gentle. You're going to shake your arms out and then stop and go in the opposite direction. Small circles or big circles. If at any point you start feeling uncomfortable or sore, please stop. And check out your arms and take a breath. We're going to do a little bit of a medley. A leg straight stretch mixed in with a seated march. Stretch the leg out and bring it back. Stretch the other leg out and bring it back. We're going to keep repeating that. And we're going to transition over to a march in place. Just where you're sitting, just going to lift your knee. Easy does it, not even to the point of feeling uncomfortable or painful. All you want to do is just get the blood flowing, get that fluid worked out of your lower legs. Easy does it. Remember to breathe in and out. If at any point you need to stop, take a breath, and we're going to switch over to stretching our leg out in front of us again. Stretch your right leg out and then your left. Beautifully done. Only do this for as long as it's comfortable. When it starts feeling too much or starts feeling painful, please stop immediately. And that is the end of our workout. Namaste. Thank you so much for joining me, and I will see you in the next one. Cheers.